So now I'm going to focus on the more recent studies that have led to practice change. The first of these is SBAC4. These data were presented a couple of years ago and now fully reported in the Lancet. And essentially it looked at the combination of gemcitabine and capecitabine compared to gemcitabine in a large cohort of patients, over 730. This study was conducted primarily in the UK and some European countries with a primary endpoint for overall survival. And these are the outcomes. There was a statistically significant improvement in overall survival for the gemcitabine-capecitabine combination compared to gemcitabine on its own. And for the period of 2016, 17, and early part of 2018, gemcitabine and capecitabine has been, for many, the go-to regimen for patients with resected pancreatic adenocarcinoma. However, we have significant data that's led to a major practice change in 2018. These data were presented by Dr. Conroy and colleagues at ASCO in the spring of 2018 and looked at modified FOLFIRINOX compared to gemcitabine. Again, this was a population that went directly to surgery. Patients were stratified based on their R0 or R1, so margin positive versus negative resection status. CA19-9 level had to be less than 180 at the time of enrollment, had to have a good performance status, and primary endpoint here was disease-free survival, and patients underwent imaging on an every 3-month basis. So a few points about the chemotherapy. This started at full dosing of modified FOLFIRINOX. However, during the conduct of the study, it was noted that there was a significant rate of grade 3 diarrhea that led to an upfront reduction of the dose of irinotecan to 150 milligrams per meter squared, and this was instituted after about a third or so of patients were enrolled. So here are the key data. Primary endpoint, median disease-free survival. Modified FOLFIRINOX was 21.6 months compared to gemcitabine, 12.8 months. And I'll make the point here that the gemcitabine population did, for the disease-free survival endpoint, did as we would have expected from multiple prior studies, and we've looked at some of the CONCO data and the SBAC data. So that number is very familiar. Hazard ratio here was very significant at 0.58 and p-value less than 0.0001. So important outcomes. And moving to overall survival, there was an overall survival outcome of almost 4.5 years for patients who received modified FOLFIRINOX compared to those who received gemcitabine. So point to note here that some of the impact in terms of overall survival comes from what patients received at the time of disease recurrence. For those with modified FOLFIRINOX, they received gemcitabine-based regimens, and vice versa for the gemcitabine alone arm. So that's the best outcome we've seen in any trial, in any setting in pancreatic adenocarcinoma. I'll also note that for the gemcitabine-treated population, the survival here for ECOG 0 to 1 patients is significant, and that survival also exceeds any prior study in the adjuvant setting. And of course, this is attributed in part to patient selection. And so making the point again that these were fit patients, performance status of 0 to 1, low CA19-9, and have undergone a successful resection, all of which contributes to improved outcome.